The My Dream for Lou Policy Summit is a space to create a community agenda for change. If you woke up one morning and Louisville had changed overnight to become the city you always dreamed it could be, what would it be like? What would be different? The My Dream for Lou Policy Summit is a place to talk about policy development and change as ways to make Louisville a better place for everyone who lives, works, and visits here. So what's a policy? At its best, policy is a shared vision for our city and the action plan to make those visions a reality. In other words, policy is both a government's vision for the future and all of the rules and laws it creates in pursuit of that vision. Policies to govern Louisville Metro are created by the mayor, Louisville Metro Council, and the different departments of Louisville Metro government. Policies for the state are created by the Kentucky State Legislature, the governor, and the various departments of the state government. Policies that govern the whole country are created by Congress, the president, and the rest of the federal government. Here are some examples of different kinds of policies. The city budget, created by the mayor and approved by the Metro Council, is an example of a policy. If Louisville Metro government decides it will spend money on something, it means the city sees it as a priority. Another example is our city's no smoking ordinance. Louisville has a local law that makes it illegal to smoke inside public buildings. A final example, an executive order created by former Governor Beshear in 2013 expanded Medicaid in Kentucky so that low-income adults could have health insurance. These are all examples of policies. But what's the difference between policies and programs? It can be confusing to tell the difference between policies and programs. The main difference is that policies create the rules and plans for action, while programs actually get stuff done. Sometimes policies can help create programs. For example, policies can say what kinds of programs are allowed, who's in charge of them, or how they will be funded. To get a better idea of what all this means, let's look at a recent example of a policy and a program working together. Heroin addiction and injection drug use have been serious issues in Jefferson County and can contribute to the spread of dangerous diseases like hepatitis C and HIV/AIDS. Last year, the Kentucky State Legislature passed a law which took several steps to address this growing problem. One of the steps this policy took was to make it legal for local health departments, like Louisville Metro Department of Public Health and Wellness, to create syringe needle exchange programs. The law requires needle exchange programs to be approved by the local Board of Health and the Metro Council. The Louisville Metro Council passed the necessary local ordinance, another policy, which then enabled the Louisville Metro Department of Public Health and Wellness to set up a needle exchange program for Louisville Metro, and the Board of Health approved it too. With the right policies in place to support it, a needle exchange program could then be created. Louisville Metro's syringe exchange program provides free needles and HIV testing and prevention supplies. The program does all of the actual work of handing out needles and educating people. But without the policy change that made public needle exchange programs legal and set some guidelines for how it would work, this program would not exist. Quickly, let's look at one more. Here's a problem identified in many places. Persons with disabilities have difficulty addressing adequate transportation. What's a policy solution? The Americans with Disabilities Act requires that local governments must ensure that wherever streets are altered, to provide curb ramps where street-level pedestrian walkways cross curbs so that persons with disabilities can use sidewalks too. That's a policy solution. A policy can help guide the development of programs and often requires programs to fulfill them. A program solution in this instance might look like a local nonprofit organization having a network of volunteers who offer flexible transportation for shopping, doctor's appointments, recreation, and other activities. These are differences between policies and programs. So what happens at a policy summit? A policy summit is an opportunity for community members, government officials, and other policymakers to get together and discuss the future of the city. It's a way to get input and ideas from many different groups of people to help set priorities for the city and come up with creative solutions to problems. At the My Dream for Lou Policy Summit, we'll talk about major issues, learn about ways other cities have dealt with these issues, and come up with ways we want Louisville Metro to start to make things better. On Thursday evening, everyone will gather for dinner and will listen to our keynote speaker discuss the significance of public policy and communities making change. Throughout the day on Friday, we'll view photo voice submissions, we'll gather into groups to discuss the top issues that the community identified as priorities through the Photo Voice project. Each group will look at different sides of their issue, look at data related to the topic, discuss options for solutions, and look at examples of what other cities have done to address similar problems. Finally, each group will create a proposal for a solution they want the city to work on to address this issue. They will summarize their work for the day in a short policy brief. A policy brief is the action plan to make a vision come to life. It is your argument that Louisville Metro government should pay attention to an issue and take the steps you recommend to address it. Policymakers, like Louisville Metro Council and the mayor, use policy briefs to help them make decisions. Policy briefs can be formatted many different ways, but they include important components, including the issue. This is where you describe the problem. A statement of significance. Why is this problem important to pay attention to? You'll say why this issue is important for our city to address. Policy briefs include the vision. What is the goal that Louisville should be working toward to solve this problem? How will we know when this problem is solved? Finally, action. What is the first step or several steps that should be taken to address the issue? On Saturday morning, everyone will gather one last time to listen to each group present their proposals. After the summit, the Center for Health Equity will work with other parts of Louisville Metro government to push for the policy changes recommended by the summit. We look forward to creating a community agenda for change with you at the My Dream for Lou Policy Summit, October 6th, 7th, and 8th. See you at the summit.